Thank you, Mr. Chairman. Thank all of you for your testimony today and for being here. And I agree, our healthcare system is at an inflection point. The status quo is not working, and we need fundamental change. The question is, what does that change look like, and where should we start first? We do have one of the most advanced healthcare systems in the world. The problem is it's leaving far too many people out, and it's not working, especially for those without the resources or the connections to navigate it effectively. Mr. Darius, over the past year in a lot of the constituent town halls that I convene, my constituents tell me all the time that they don't want to go back to the status quo. The status quo doesn't work for them either. So in your testimony, you note that while modernization and innovation are worthy goals, and they are, to fully realize their impact, the fundamentals of the underlying system must be strong. So can you talk to us about what those fundamentals should include? What is that foundation that we should be working to make sure is in place for everyone?
Yeah, and I think, thank you for the question. I think the exact answer, right, is the work that we can all do together to work through exactly what that looks like. But generally speaking, I think it's a system where everyone is covered, just because that's the way insurance works. So whether it's through a patchwork of the programs that we have currently and finding ways to make those work more efficiently, or if it's through a different system, right, where everyone's covered in a more streamlined way, I think that's worth pursuing. I think finding ways, again, I'll say, to build trust between all the entities that are in the system itself. How do we kind of recognize the expertise that different people have, right, whether it's providers or insurers, whatever it is. How do we recognize that level of expertise that exists in the system, and also to just trusting average people? I think so much of what the policies that we talk about just have a hint of distrust of working people. I'll say that. Again, I talked about this coverage gap that exists, right, where you have people who, if they earn $9,000, they're suddenly too rich for Medicaid in Florida, but also don't qualify for tax credits in the marketplace. So all over kind of throughout the system, there are these kind of conflicting incentives, right, or just gaps that exist. And I think if we sit down together and work through, what the ultimate solution looks like, that's possible, but just fundamentally keeping some of those kind of guideposts in mind as we build that out.
Yeah. I also appreciated the comments about clearly there needs to be more attention on the metabolic disease crisis, and that obesity is a biological disease, not a personal failing. Diabetes, kidney disease are all downstream consequences of metabolic dysfunction, and I think that is something that we need to tackle further. Dr. Davis, your testimony, I could feel it in your heart, the passion that comes through, and the fact that you went into this profession thinking you were going to change it in one way, and while in it, you realized there was another approach that needed to be taken. And I fundamentally agree. We need a wellness-based approach, not a sick-based approach. So can you talk a little about, again, the determinants of health, nutrition, stress, environmental toxin remediation, as you stated in your testimony, which are root causes of disease throughout our country, and where those elements should be? Because unfortunately, they're not a high enough priority when we're cutting research or cutting funding or cutting access to food, not providing access to stress or wellness mitigation and other environmental issues. Can you speak a little bit more to that, please?
Absolutely. Again, thanks for that question. I think I'll start by just kind of talking about how I made this transition from an interventional cardiologist, doing the things that I was doing 10 years ago, to the type of medicine that I practice now. And it started with just really a program where we focused on 5 basic pillars. We focused on nutrition and movement and detoxification, sleep, and stress management. And what I was doing, I had one day of a clinic where I just would help. We had a wellness program, right? We developed a wellness program that was a 6-month program. And we basically taught people about all of those different pillars of health. And very shortly, 2-3 months into doing that kind of wellness program, what we did monthly was we had the patients who had enrolled for the program. We'd come into my office, we'd sit around in the front in the waiting room, and we started off by saying, you know, everybody, let's go around the room, let's tell your win for the month, right? And it was absolutely amazing to me as we started this program how, I mean, everybody would stand up and they would give their kind of what happened. And, you know, things like headaches going away, their rashes going away. I lost 20 pounds. I no longer have the arthritis issues. And I remember distinctly, we had a room set up with a table up in front where we had different presentations. And I used to sit in the back corner of my office. Now I sat way back in the back. And I remember thinking to myself, 2-3 months in, I was like, man, I got this all wrong. Got to figure out how we do this. Like, how do we fix this? And so in addressing those pillars of health and teaching them, it's about education. It's about the things that they don't know, the things that I didn't know as a physician, right? All the stuff that, you know, how many years did I tell people you need to eat a low-fat diet and go get some exercise and then hope they come back and they're better, right? What did I truly do to get them better in that visit of 7 minutes and saying, yeah, you really need to lose some weight, and with no instruction, no roadmap. And so when we started to do that and we started to give them the roadmap and addressing those pillars, things started to change. And so really that is what I think we need. We need education. Physicians need education. Patients need education to empower themselves to take control of their health. Right now they have no clue. So that's kind of, I think, what we need to be focused on. How do we roll out wellness programs to empower people to take back their own health, right? Yeah. To motivate people.
Your comment said to move from fear to ownership, from prevention to access, to change what we value, and to reward prevention, not procedures. I think all of those are qualities that Chairman Buchanan and other members of this committee are working towards. It's why he wanted us to be here to hear from all of you. So thank you again for your testimony today.
And